Hey there, welcome back to the show. So, something I hear from women from time to time is that they've started hormone replacement therapy, but they don't feel right. They often feel worse, and they get frustrated because their provider doesn't offer much support. And unfortunately, they get so discouraged that they even stop taking the hormones. This is really upsetting to me because I have found so much benefit from being on hormone replacement therapy. We have seen great outcomes with our clients, and I know that it can be incredibly health supportive for so many women. Of course, in addition to making vital food and lifestyle changes in your perimenopausal years and beyond. Now, if you're new here, I have talked about hormone replacement therapy in several of my previous episodes, so go back and listen to those. I'm not going to dig into the history, the safety, or the efficacy in this episode because I really want to focus on some troubleshooting. So, say you started HRT, but you feel like it's not working or you feel worse. Here's some things I want you to consider. The first one is your doctor may have put you on synthetic hormones versus bioidentical. For example, you may be on a progestin versus bioidentical progesterone. Now, there are plenty of doctors and well-known hormone experts out there who do recommend progestins, and they use them personally. And some of them use these terms interchangeably, which drives me bananas because they are different. I recommend women use bioidentical hormones when possible because they mimic the exact molecular structure as the hormones that your body produces naturally. So the argument for the use of progestins, or a few arguments, is some women may be progesterone resistant, which I'm going to get into in a minute. The other thing is that some women may have very heavy bleeding, so a progestin will reduce that fairly quickly. And of course, a progestin will also protect the uterine lining if you are on estrogen hormone replacement therapy. However, bioidentical progesterone can also help with heavy bleeding and protect the uterine lining, and it has many more benefits like improving your sleep, your mood, anxiety, weight, and more. Now, in regards to progesterone resistance, I want to touch upon this because even though it is somewhat rare, we're seeing this more and more. Again, amongst my colleagues, we talk about it often, how we're seeing more and more women who are pretty sensitive to progesterone. It's certainly a case-by-case basis, but some reasons for this may be you may be sensitive to the excipients if you are using a commercial progesterone. For example, Prometrium, this is still bioidentical. It's something that is FDA approved. You can get it at most, not grocery stores, pharmacies. But they do have some other ingredients in there like peanut oil that you may be sensitive to. Another reason is that your gut and your immune system may be in overdrive and need a lot of support. So you're reacting to these ingredients. There's also a possible association with PMDD, premenstrual dysphoric disorder. I am quite familiar with PMDD because not only have we have clients who have been diagnosed with it, but I was diagnosed with it myself many years ago in my 20s because I struggled big time with my mood around my period. Luckily, knock on wood, it hasn't been an issue for me. I really think it's because of all the food and lifestyle changes I've made, supporting imbalances, nutrient deficiencies. However, unfortunately, it can be exacerbated for women in their perimenopausal years because of the fluctuation in hormones that is occurring. Now, it seems that women with PMDD may have trouble with a metabolite of progesterone, which is known as allopregnenolone. This can cause depression and anxiety in a lot of women. So some providers, when starting women on progesterone, will start really low and slow with dosing. However, commercial progesterone starts at 100 milligrams. And while this is typically a low dose, and a lot of women need more than that, for a woman who is very sensitive to progesterone or progesterone resistant, that's where compounded progesterone is a great option because you can start at a much lower dose. You can start at 25 milligrams or even lower if necessary, and then slowly titrate up until you find your sweet spot. The other thing to consider is maybe oral micronized progesterone isn't a great option for you and you have to insert it vaginally, rectally, or you may even need a topical formulation instead. Another reason that your HRT may not be working is you have pellets. Now, there's no judgment if you use pellets or if you're a provider who's listening and you use them with patients. I've said this many times before. I don't like black and white thinking when it comes to health, similarly to when it comes to the various HRT options. There are things that I would recommend first and foremost with clients, and things that I use myself, but we're all unique and we have different needs. So some women have been using pellets and they love them, while others feel really terrible because the dose, once they're inserted, cannot be titrated. And unfortunately, a lot of doctors who recommend or prescribe pellets don't have a ton of training in hormones in general. Another reason is your doctor may have started you on a dose that's way too high. So ideally, with most hormones, whether it's progesterone, estradiol, and testosterone, you would start low and slow, increasing over time until you find your sweet spot. Conversely, your dose may be too low. Many doctors believe that women should be on the lowest dose possible, as well as the shortest time frame possible when it comes to HRT. Both of these are false. Some women need higher doses of hormones. For example, you may need 400 milligrams, 500, or even more of progesterone, or like the highest dose of an estradiol patch, which I'm on right now. I'm on the highest dose right now. I did not think I would need this much estrogen. Clearly my body needs it. And again, it is a case-by-case basis. So you have to find what works for you in order to feel your best. And then just a side note in terms of doctors or providers who say that you should only be on hormone replacement therapy for a short amount of time, false. You can be on that lifelong. I plan to until somebody pries it out of my hands. Another thing to consider is you may be only on DHEA, testosterone, and or progesterone, and your provider isn't addressing your need for estrogen. This drives me bananas because too many providers are afraid of estrogen, which is ridiculous. And they tell women that they don't need estrogen if they're still cycling or they have a regular period. But if you have symptoms of low estrogen, like joint pain, vaginal dryness, dry eyes, dry skin, frequent UTIs, urinary incontinence, low libido, low mood, just to name a few, then you very likely need some estrogen. And just because you're still getting a period, even if it's regular, that does not mean that you may not benefit from estrogen. Now, I'm not saying that every woman needs it, but again, case-by-case basis. Look at your symptoms. Symptoms don't lie. All right, the next thing to consider is you may need a different type of application. For example, you may not love using an estradiol patch, or you may find that you have issues with absorption, whereas maybe a cream or even a spray is a better option, or even oral estrogen. And yes, a lot of providers or a lot of people are so against oral estrogen, but again, it really depends on the woman. There's different risk factors you have to look at. And another example is if you have maybe had testosterone pellets in the past, maybe you had a really bad experience, or even injections, but you may do better with a compounded testosterone cream. The other thing, and this is probably the most important in my professional opinion, is that you haven't made any dietary or lifestyle changes or addressed underlying imbalances, like I mentioned earlier, nutritional deficiencies, poor gut health, stress, detoxification or sluggish detoxification. Because, once you start to use these hormones, you want to make sure you're using them and then eliminating them, or use and lose. All that said, hormones are incredible. Clearly, I am an advocate for them, but they aren't a silver bullet. So if you're eating a lot of processed foods, sugar, drinking alcohol, have a lot of stress in your life, have poor sleep hygiene, meaning that you get to bed really late, you're on your phone, you're not relaxing before bed, then please, please, please start to make some changes, because you're not going to get everything you need just from taking hormones. You must make these other changes that I'm always preaching about. If you need guidance on that, make sure you grab my free guide that gives you some practical action steps to take now to start supporting your body through these hormone changes in perimenopause. Go look at the show notes for a link to that, and I hope you like that episode. See you next week. Hey, before you go, if you're ready to get educated, empowered, and feel your best in your peri years and beyond, grab my must-have guide for women 40 plus navigating hormone changes via the link in the show notes. You'll learn my top 5 strategic diet and lifestyle changes to make ASAP to support your declining hormones and get back your energy, improve your mood, and confidence. The information provided is for educational and informational purposes only. I am not, nor do I act as a doctor or any other medical professional. I am not providing healthcare, medical services, or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional disease or condition. The information shared is not intended to be a substitute for the professional medical advice provided by your own medical or mental health provider.